Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the direct inguinal hernia. Hernia is the protrusion of a viscera or a part of it into the inguinal canal, which has three parts: superficial inguinal ring, deep inguinal ring and the inguinal sac. Superficial inguinal ring. It is a triangular opening in the aponeurosis of the external oblique muscle. The ring is bounded by superomedial and inferolateral crust joined by crisscross intercrural fibers. Normally it won't allow even the little finger. Deep inguinal ring. It lies above the inguinal ligament and midway between symphysis pubis and anterior superior iliac spine. It is a U-shaped condensation of transversalis fascia and open above. Inguinal canal. In infants, the superficial and deep rings are superimposed. In adults, it is about 1.5 inches long, directed downwards and medially. In males, transmits spermatic cord, ilioinguinal nerve and genital branch of genitofemoral nerve. In the female, have round ligament in place of the spermatic cord. Boundaries of inguinal canal. Posteriorly internal oblique, anteriorly internal oblique fibers, superiorly internal oblique and inferiorly inguinal ligament. Direct inguinal hernia. Half of the direct hernia are bilateral. It is always acquired. The sac passes through the weak or defect of fascia transversalis in the posterior wall of the inguinal canal. In some cases, the defect is small and related to the insertion of the conjoint tendon, and in others there is a generalized bulge through HESELBAC'S triangle. Usually the patient is male with a poor abdominal musculature. Predisposing factors are chronic cough, constipation and heavy work. The size is never large and never descend to the scrotum. It is behind the spermatic cord. A finger inserted into the superficial inguinal ring passes directly into the abdomen. On coughing, the impulse is felt on the pulp of the finger. The inferior epigastric artery lies lateral to the aperture but can't be felt. At operation, the distinguishing feature is the sac lies medial to the inferior epigastric artery. The spermatic cord is not attached to the wall of the sac. There is usually smaller than the hernial mass, would indicate the protruding mass mainly consisting of extraperitoneal fat. Strangulation is rare. Injury to the iliohypogastric or ilioinguinal nerve during the gridiron operation for appendicitis appears to be associated with the development of a right inguinal hernia. Treatment. Indications for surgery. The hernia which is enlarging, the patient is a young adult and engaged in strenuous occupation, it is indicated. A small direct inguinal hernia is not necessary to an indication for operation, as the risk of strangulation is less. Operation for direct inguinal hernia. It consists of dissecting and opening the hernial sac, reducing the contents and tying the neck of the sac. The sac After it has been dissected free from surrounding structures, he is inverted into the abdomen and the transversal fascia repaired in front of it. Some form of reconstruction of the posterior wall of the inguinal canal completes the operation. Facial flaps, nylon dons, tantalum gauge and dicron net implantations are popular for repair. Funicular direct inguinal hernia, prevesical hernia. It is a narrow-necked hernia with a prevesical patch and a protrusion of the bladder that occurs through a small oval defect in the medial part of the conjoint tendon just above the pubic tubercle. It is common in elderly males and occasionally it becomes strangulated. Here the operation is the must for correction. Buell hernia or saddle bag hernia, pantaloon hernia. There are two sacs which straddle the inferior epigastric artery. One sac is medial and the other lateral to this vessel. It is caused by recurrence. One of the sacs are having been overlooked at the time of operation. That's all about the direct inguinal hernia, and in the next video I will discuss about strangulated hernia. Thank you very much.